Hello, Kennedy Cougars. My name is Shane, and I am hosting Medtalk for this year. If you are new to the medical magnet or just forgot, Medtalk is one of the video segments on the YouTube channel. Here, I will talk about metal diagnosis, specifically the Aligning Awareness Month diagnosis. I will explain the symptoms, treatment, and lifestyle surrounding it. This month's awareness is COPD, chronic obstructive pulmonary disease. COPD awareness helps people understand the risks of smoking and chemical exposure. It may also help people with symptoms to seek treatment earlier and could even improve an individual's life expectancy. COPD is a serious lung disease that makes it difficult to breathe. It's most common in older adults, but you can take action to look after your lung health at any age. National COPD Awareness Month uses the color orange to symbolize energy, determination, and hope in the fight against COPD. Orange is often associated with the lungs and breath, serving as a vibrant, noticeable color to raise awareness about the disease and encourage people to take action for better lung health. The main cause of COPD in developed countries is tobacco smoking. In the developing world, COPD often occurs in people exposed to fumes from burning fuel or cooking and heating in homes that don't have good airflow. Long-term exposure to chemical fumes, vapors, and dust in the workplace is another cause of COPD. Not all people who have smoked for a long time have COPD symptoms, but they may still have lung damage, so their lungs don't work as well as they used to. Some people who smoke get less common lung conditions that may be diagnosed as COPD until a more thorough exam shows a different diagnosis. COPD symptoms often don't appear until a lot of lung damage has occurred. Symptoms usually worsen over time, especially if smoking or other irritating exposure continues. Symptoms of COPD may include trouble catching your breath, especially during physical activities, wheezing or whistling sounds when breathing, ongoing cough that may bring up a lot of mucus. The mucus may be clear, white, or yellow, or greenish. Chest tightness or heaviness, lack of energy or feeling very tired, frequent lung infections, losing weight without meaning to, and this may cause the condition to be worse, swelling in ankles, feet, or legs. This time of worsening symptoms is called an exacerbation. Exacerbations can last for several days to weeks. They can be caused by triggers such as smells, cold air pollution, colds, or infections. Symptoms may include working harder than usual to breathe or having trouble breathing, chest tightness, coughing more often, more mucus or changes in mucus color or thickness, fever. The most common lung function test is called spirometry. A spirometry test can diagnose COPD. A spirometer can measure the amount and speed of the air you blow out. This helps your healthcare provider see how well your lungs are working. Quit smoking. Quitting smoking is the most important step you can take to help slow the progression of COPD. Talk with your provider about programs and products that can help you quit. If you are having trouble quitting smoking on your own, consider joining a support group. Medicines. Medicines to treat COPD symptoms include bronchodilators and a combination of bronchodilators and steroids. Your healthcare provider may prescribe an inhaler for you to carry at all times. Your provider may ask you to try inhaled steroids with a bronchodilator for a trial period of 6 weeks to 3 months to see whether the addition of the steroids helps you breathe better. Pulmonary rehabilitation. Pulmonary rehabilitation is a supervised program that includes exercise training, health education, and breathing techniques for people who have certain lung conditions, have lung problems due to other conditions, or have had a lung transplant. Oxygen therapy. Oxygen therapy is a treatment that delivers oxygen for you to breathe. If you qualify for oxygen therapy, you will receive it from tubes resting in your nose. a face mask, or a tube placed in your trachea, windpipe. Surgery. Surgery may benefit some people who have COPD. Surgery usually is a last resort for people who have severe symptoms that have not improved from taking medicines. Bulectomy removes one or more very large bullae from the lungs. Bullae are larger air spaces that form when the walls of the air sacs are destroyed. These air spaces can become so large that they interfere with breathing. Lung transplant. A lung transplant is a surgery to remove a diseased lung and replace it with a healthy lung. Lung transplants are used to improve quality of life and extend a lifespan for people who have severe or advanced chronic lung conditions that do not respond to other treatments. Thank you for watching this month's Medtalk. See you next month in January for Thyroid Awareness Month.